Now, emergency and urgent care at Stockport's Stepping Hill Hospital has been rated inadequate by the health watchdog, the Care Quality Commission. It follows 2 inspections of the hospital earlier this year. The Trust said it has been working hard to improve. Let's talk to our health correspondent, Jill Dummigan. She's live for us at Stepping Hill this lunchtime. What was the CQC, Jill, most concerned about?
Well, Roger, the CQC said that the staff here were caring, it's just that there weren't enough of them. There was an over-reliance on agency staff and bank staff, and there weren't enough of those either. There was a particular problem with a lack of nursing staff. Now, they had raised concerns, there was low morale because they felt there weren't enough of them to do their job properly. And this played out in a number of ways, including ways that affected patient safety. So, for example, procedures to identify patients who are deteriorating weren't being carried out. Trolleys and cubicles weren't being cleaned properly. The report did highlight other concerns, too many people left on hospital wards who should be getting cared for in the community, but really staffing was at the heart of this.
There are a group of regular protesters at Stepping Hill, Jill, who are concerned about NHS privatisation. Have you been speaking to them?
Yes, they gather here every Tuesday. They've been doing that ever since August 2016, when the hospital closed down a ward and also lost 350 posts to save money. Now, unsurprisingly, they're saying that these more recent problems are also linked to a lack of money.
We talk to patients as they're going in and out of the hospital, and they tell us on the whole that people in there, the nurses, etc., and all the staff are working really, really hard, but they're just really struggling to do it because there's a lack of money.
What's the Trust said, Jill?
Well, I spoke to the medical director, Dr. Colin Wasson, today. His main point was that this inspection, or the main part of it, was 6 months ago. That since then they've been on a big recruitment drive to India. They've also put more stringent procedures in place. He said that anybody coming here today can feel safe.
We've done a lot of work looking at our nurse staffing and how we recruit and retain our staff, how we develop our staff and make them know their jobs inside and out. I think we've had an opportunity in this CQC report over the last 6 months to prepare for winter the way we've never been able to prepare before. And I think that opportunity means that we will be offering safe care to our patients as they arrive.
Now, this inadequate rating, I should clarify, is for urgent and emergency services and for safety overall. But the Trust and the hospital overall have been given a higher rating of requires improvement.
Jill, thank you. Jill Dummigan there. Now, staff at Merseyrail and Northern
as one of Greater Manchester's 4 super hospitals. Yet it's been revealed today that safety, along with emergency and urgent care at Stockport Stepping Hill Hospital, has been rated inadequate by government health watchdogs, the lowest possible rating.
The Care Quality Commission's inspections in March and June also found that the Trust overall required improvement. Those in charge say that that is already well underway, as our health correspondent Jill Dummigan reports.
Every Tuesday morning, a small group of protesters gathers at the entrance to Stepping Hill Hospital. They began in August 2016, when the Trust closed a ward and 100 staff posts to save money. And they're convinced that a lack of cash is at the heart of the current problems.
We talk to patients as they're going in and out of the hospital, and they tell us on the whole that people in there, the nurses, etc., and all the staff are working really, really hard, but they're just really struggling to do it because there's a lack of money.
The CQC found that staff were caring and compassionate, but that there wasn't enough of them. There was a high use of agency staff, particularly for nursing staff. Safety in the emergency department wasn't a sufficient priority. And staff morale was low because they felt there were too many people to look after properly. All this played out in a number of ways, sometimes impacting on patient safety. So, for example, cubicles and trolleys weren't being cleaned properly. Sometimes patients who were deteriorating weren't having that fact recorded. Patients with diabetes weren't having the condition managed properly. All because staff were too busy trying to make up for those unfilled posts. The Trust says since the inspections were made in March and June, they've had a recruitment drive in India and tightened up safety and training procedures.
We've done a lot of work looking at our nurse staffing and how we recruit and retain our staff, how we develop our staff and make them know their jobs inside and out. I think we've had an opportunity in this CQC report over the last 6 months to prepare for winter the way we've never been able to prepare before.
Some of the problems go beyond this hospital trust. The inspectors found that too many people were sitting in hospital beds who should be out in the community getting social care. A combined council and health body in Stockport was given millions of pounds to set up a vanguard designed to make that system work better. Those behind the project say it's a big job and it's only started to show results in the past few months.
The changes we're making and the investments we're making take time to play through the system, and we're pleased to see that there's been a significant improvement in how quickly people are being discharged from hospital, and we've seen improvements to the safety of patient care within the hospital in that time as well.
This inspection calls for vital changes. Those in charge say they've been made. The test will be the coming winter. Jill Dummigan, BBC North West Tonight, Stockport.
The husband of a great